Hello, welcome to this video on ozone therapy, brought to you by Dr. Shruti Sridhar and the Purple Coat Clinic, Pune, India. Ozone is a highly toxic gas and should not be inhaled. So, how is it used in medicine, you ask? Let's find out. The history of ozone gas therapy dates back to the late 1800s and early 1900s when it was first starting to be explored for its therapeutic benefits. Ozone was first discovered in 1839 by Christian Schonborn in a laboratory. From the 1880s, ozone started being used in medical settings. There is documented evidence of ozone gas being used in World War I to treat infected wounds, gangrene, and effects of poisonous gas. Between the 1930s and 1950s, ozone was popularized for dental treatments, disinfecting wounds, and treating chronic infections because of its germicidal properties. Gradually, the use spread to various countries, including Cuba, Russia, Italy, and Germany, where researchers began conducting clinical trials. Although its widespread use remains controversial, smaller studies have shown great clinical outcomes in certain indications. So, if ozone is toxic, how is it administered? It is given via breathing through oil, ear, skin, rectum, vagina, intramuscular, or intravenous. What does ozone gas do once administered? Ozone gas disintegrates quickly to generate free oxygen radicals, which is a strong antioxidant. It can neutralize oxidative stress in the body and contribute to anti aging. Oxygen comes off as a byproduct of this disintegration of ozone, which is quickly absorbed into the tissues and blood cells. Ozone also increases ATP generation or energy production and increases glucose utilization. It primes the white blood cells or our immune cells to function better. It increases elasticity of cell membranes and tissues. It has the ability to kill bacteria, fungi, and viruses, all the while sparing our own cells. Ozone therapy can be used as an adjunct treatment in many indications. Let's see them one by one. In circulatory disorders, it can help improve oxygenation of tissues and improve elasticity of blood vessels. It can be helpful in recurrent calf pain, varicose veins, Raynaud's disease, atherosclerosis, and post stroke effects. In autoimmune conditions like rheumatoid arthritis and lupus, it can help neutralize oxidative stress and improve antioxidant capacity of our body. It can modulate the immune response, thereby improving the disease condition. In metabolic conditions, it can increase glucose utilization. When administered rectally, it directly passes into the liver via portal circulation. Hence, we see great therapeutic usage in fatty liver, liver cirrhosis, and diabetes. Vaginal ozone has found its place in many women's health issues. Due to its bactericidal and fungicidal properties, vaginal ozone can be used to treat recurrent vaginosis or recurrent vaginal infections. Vaginal ozone also can impact the uterus and be used for modulating blood supply in the uterus in conditions like adenomyosis and endometriosis. It can also be used for conditions like IBS, fibromyalgia, chronic fatigue syndrome, allergic dermatitis, post stroke, neurological deficits, and wound healing. For chronic conditions, ozone therapy requires 8 to 10 sessions in the beginning, which is to be done at regular intervals as per the patient's response. Both invasive and non invasive routes can be given depending on the indication and the patient's compliance. If you would like to know if ozone therapy is the right fit for you, please get in touch on the given email or phone number. Thank you for listening.